Good morning. Welcome to this course on ocular genetics and retinal genetic eye diseases. So, history of gene therapy. In the 1940s, nucleic acids were identified as the carriers of genetic information. In the 1960s, virus-based methods for delivering therapeutic genes to patients were developed. In the 1970s came recombinant DNA technology and first approved gene therapy clinical trial in 1990 for children with severe combined immunodeficiency. Why eye is suitable for gene therapy? The eye is partially shielded from the immune system, reducing the possibility of an immune attack on the virus used to introduce the genes. The eye is also relatively easy to access, allowing surgeons to inject the virus near to the cells in which the gene is needed. Because more than 200 genes are associated with retinal disorders, the opportunities for genetic correction is enormous. How retinal gene therapy works? The vertebral neural retina contains many different types of cells like retinal ganglion cells, rod and cone photoreceptors. Rod and cone photoreceptors, etc. In retinal gene therapy, adeno-associated virus enters these various types of cells and expresses the DNA sequence of intended therapeutic value. So the AAV is the one which is used, and retina cells are non-dividing, therefore AAV persists and provide therapeutic expression of DNA sequence over a long time period. In 2008, 3 independent research groups reported that patients with the rare genetic retinal disease Leber's congenital amaurosis had been successfully treated using gene therapy with AAV. In all 3 studies on AAV vectors was used to deliver a functional copy of the RPE65 gene, which restored vision in children suffering from LCA. And AAV as a vector for gene therapy. The great advantage in using AAV for the gene therapy is that it possesses minimal immune responses and mediates long-term transgene expression in a variety of retinal cell types. Initial studies have used AAV serotype 2. Nowadays, new variants of AAV are being developed to increase the efficiency of gene transfer process. After intravitreal injection, only AAV serotypes 2 and 8 were capable of transducing retinal ganglion cells. Administration of gene therapy to retina. Generally, AAV is administered by 2 routes, intravitreal or subretinal. In the intravitreal route, targeting retinal ganglion cells and a few Muller glial cells, AAV is injected in the vitreous humor of the eye. In the subretinal route, targeting photoreceptors and RPE cells, AAV is injected underneath the retina. And these different routes are necessary for different cells because the inner limiting membrane and the various retinal layers act as a physical barriers for the delivery of drugs and vectors to the deeper retinal layers. Generally, subretinal AAV is more efficient than the intravitreal route because the subretinal route may be subject to a greater degree of immune privilege compared to the intravitreal route. And that's my interest as a vitreoretinal surgeon because we need a vitreoretinal surgeon to do the gene therapy, that too in the subretinal space. And regulation control of transferred gene. Since continuous strong expression of newly transferred gene is sometimes harmful for long-term retinal health, it is necessary that such gene expression should be regulated by some means. One way is using a promoter system in AAV vectors which can be regulated externally. One example is tetracycline induced expression system, which uses a silencer or transactivator AAV2 vector and a separate inducible doxycycline response coach injection. Applications of the gene therapy in different eye conditions. Retinal gene therapy holds great promise in treating different forms of non-inherited and inherited blindness. Let's have a look at eye diseases for which retinal gene therapy holds promise. Mitochondrial Leber optic neuropathy. It's a retinal disease of ganglion cells that leads to blindness in young adults. 1G to A transition in mitochondrial DNA at position 11778 in the gene encoding subunit 4 of NADH dehydrogenase ND4 leads to a position 340 arginine to histidine substitution that is responsible for approximately half of the LHON cases. Studies showed that allotopic mitochondrial gene delivery can be effective and safe mode of therapy for LHON. And Leber hereditary optic neuropathy, the maternal mitochondrial DNA mutation, presents typically in males, third decade, occasionally in females, any age, initially unilateral visual loss, fellow eye involved within 2 months, bilateral optic atrophy, signs disc hyperemia and dilated capillaries, telangiectatic microangiopathy, vascular tortuosity, swelling of peripapillary nerve fiber layer, subsequent bilateral optic atrophy. And Leber's congenital amaurosis in 2008, 3 groups reported positive results of clinical trials using adeno-associated virus for Leber's congenital amaurosis. In these studies on AE vector encoding the RP65 genes were delivered via subretinal injection, and that's I think Dr. Gerald Schultz will be talking about it, which is the most expensive treatment in the world in any medical history so far. It's about 5 crore rupees or 4.5 lakh dollars. Across 3 trials, no serious adverse events were observed. Furthermore, patients in all 3 studies showed improvement in their visual function and continuing to do well after more than 1.5 years. And the other condition is wet AMD, which is treated with frequent injections of recombinant protein into the eyeball. Therefore, scientists are working on long-term disease management by a single dose of drug, and which is will be the dream project. And here you see a patient with the ARMD with a submacular hemorrhage. The other condition is choroideremia. One clinical trial reported in January 2014 used subretinal AAV to restore the RPE gene in affected patients, and initial research stated that all patients had better vision. And that's a fundus photograph of a choroideremia. And color blindness, which is so far, I think there was no treatment or nothing could be treated, but at least there is some ray of hope and there's some light in the end of the tunnel. Recent research has found that AAV can successfully restore color vision to treat color blindness in adult monkeys. And juvenile retinoschisis, it is an X-linked recessive degenerative disease of the central macula and affects the nerve tissue in the eye, and the disease is caused by mutation in the RSI gene encoding the protein retinoschisin, important for maintaining the synaptic integrity of the retina. The AAV5 vector containing the wild-type human RSIC DNA driven by a mouse opsin promoter showed long-term retinal function and structural recovery and improvement in the retinal structure reliability. And this is the X-linked juvenile retinoschisis with a foveal cyst. And the other condition is retinitis pigmentosa. It is an inherited disease which leads to progressive night blindness and loss of peripheral vision as a result of photoreceptor cell death. And most people who suffer from RP are born with dysfunctional rod cells, so they are effectively blind at night time, since these are the cells responsible for vision in low levels of light. After that, cone cells death occurs, which are responsible for color vision and acuity. Loss of cones leads to full blindness in children. And that's a fundus photograph of a RP patient. And the disease can be inherited as an autosomal recessive, autosomal dominant, or X-linked type. And unfortunately, India has the highest number of RP because of all the forms of inheritance, as well as there's a consanguineous marriage in India, and which is still there going in the families. And when mutations occur in the rhodopsin, the directional protein movement is affected because the mutations can affect protein folding, stability, and intracellular trafficking. Gene therapy to RP is introducing AAV delivered ribosomes designed to target and destroy a mutant mRNA. And this is the RDH11 syndrome with the defective genes RDH11. And another mutation in the rhodopsin structural protein, specifically peripherin 2, it can lead to recessive RP and macular degeneration in humans. And if the mutation RP is unknown, then gene replacement therapy cannot be administered accurately. And the other is the retinal degeneration. It's an inherited eye disease characterized by irreversible photoreceptor loss. And in summary, vision loss from inherited retinal disease is a debilitating condition. However, with many gene therapies available to ophthalmologists, there is hope for patients. And the main target for ocular gene therapy involves retinal pigment epithelium or photoreceptors. And the most common method to deliver viral vectors to these cells includes intravitreal subretinal injection of or access from the suprachoroidal space. And the recombinant adeno-associated virus can be engineered to maximize gene delivery to specific targets. And we have an Asian Eye Genetic Consortium, which was established in 2014 as an extension of the NIH, and it focuses on the eye research in Asia. And